Well, I'm sure we've all said it before. My body doesn't look or feel the same after 30, 40, or fill in the blank. And while some people might tell you you're crazy, there is science behind it. Dr. Buzz from Buckeye Physical Medicine and Rehab is here to tell us all about metabolic aging. So good to see you, Dr. Buzz.
Good morning. How you doing, Robin?
I'm doing good, and I'm, interested in this because you might just automatically think you know what metabolic aging is, but you are talking about some science really behind this, right?
Yeah, your metabolic age is how you're aging on the inside. So it's not on the calendar, that's what's inside. And there's four basic hormones that control your metabolic age, and that's insulin, that does not decrease with age, but then you have testosterone, growth hormone, and IGF-1 that do decrease with age and stress.
Okay, so does it happen at different times for men and women? What is that cutoff age that we're all looking for?
Usually around like 35-ish is when there's a steep decline in these things, but that's also stress related. So if you have a lot of stress in your life, the more stress you have, the quicker it can age you metabolically. So we have people that come in their 30s that are ex-military police officers that are metabolically 40, 50, and 60-year-olds.
Okay.
So you really can't, it depends on your stress and your age, but 35 is kind of where I recommend you should at least get checked.
Okay, where you should see if something's not what it used to be.
Correct, correct.
Okay, so what are the symptoms someone should be looking for to be able to tell that they're maybe aging metabolically?
Yeah, what we commonly hear is you have difficulty sleeping. You don't sleep like you used to. Not mentally sharp. You don't have that mental edge anymore. You notice you're decreasing muscle mass in your body, increasing body fat, especially around the abdomen area.
Okay.
Your skin becomes more loose, your hair more brittle, decreased libido. These are all signs that you're aging metabolically.
So if they come in, how do you go about checking them to see what their metabolic age is?
First thing is just ask them those simple questions. Do they have the symptoms of it?
Okay.
And if you have the symptoms, it's as simple as doing a blood work. We have 5 convenient locations in Columbus. Come in and get a blood work. The blood work doesn't lie. And we look at all those levels. We look at vitamin levels, hormone levels, even organ function to see why you're feeling that way.
So if they come in, you find out they're 50, 60, what are the treatment options? What can they do to help themselves?
Well, at Buckeye Physical Medicine and Rehab, we have different therapies for testosterone and growth hormone to get those to youthful levels, and we only use bioidenticals. So the things we use are identical to what your body produces, so they're safe and effective. So
once they go through that treatment, how long are they on treatment, and what kind of results will they see?
One thing that's important to understand with your metabolic age is once your testosterone or growth hormone levels decrease with age, there's nothing you can do to get them to ever come back other than to treat them. It's not curable, if that makes sense. So someone can have high blood pressure and change their diet and maybe quit smoking cigarettes and they can get off their blood pressure medication. But if you have aged metabolically and your testosterone's decreased, growth hormone levels have decreased, the only thing you can do is treat that, and that's what we specialize in at Buckeye.
Now, is it then important to get ahead of that? Like you said, 35, maybe get it checked out if you're not quite sure, because when you get to be maybe 60 and you go in, there might be a lot more going on.
Well, there's more of a health risk. What the research shows is being on hormone replacement therapy is safe and effective. There's 2 large studies that just came out. One of them tracked males. Males, the #1 cause of male death is cardiac arrest, and they found males with low testosterone levels were 25% more likely to die of heart attack.
Okay.
And they did another long-term study where they had thousands of military males, and they followed them for 20 years. And they found that the mortality rate of those with low testosterone levels was 40% greater than those with higher testosterone levels. So obviously, the longer you run low testosterone, not only do you lack energy, aches and pains, all these different things, you're more likely to have health issues.
So what are some of the benefits? Not having these things, I would take it?
Yeah, I mean, #1, having energy. I drove by Starbucks on the way in here this morning, and there was a line of cars, the whole way down the row.
Sure.
These are people that are lacking energy when they get up in the morning. I have 2 young boys. I'm 46-year-old, but I have a 10-year-old and a 12-year-old. So when they get done with school and football practice at 8 o'clock at night, they want to go outside and throw the football and do stuff. Before I was on hormone replacement therapy, at that time of day, I just want to sit and watch TV. Now I go out there, I play football with them, do whatever. So literally, for the cost of a cup of coffee is about $5, $6.
Yeah.
You can be on hormone replacement therapy and feel great.
Okay, that's pretty good. So how does a person get started, Dr. Buzz?
Step 1 is simply come to one of our 5 convenient locations in Columbus. You can go to our website, which is buckeyepmr.com, and find a location and come in and get blood work done. Usually, if you have any type of health insurance, that'll cover that blood work. And just see what your levels are and see, if you're feeling some of these symptoms, you're tired, lack energy, aches and pains, decreased libido, come get checked out and see what's going on. And if it's not hormonal, it's something else, we'll figure that out too.
All right, easy as that. Dr. Buzz, thanks for being here.
Thank you.